Hello class, welcome to Module 4. There are a few things that I want to point out to you that will help you understand the connections between topics we have discussed previously and your growing role as a leader and advocate. When we look at the chapter readings for Module 4, one thing that really sticks out to me in the focus of Chapter 11 that talks about crisis planning and emergency response. I read a really good article one time about how effective leaders spend their time, and one component of that discussion involved looking at what percentage of time you spend on various activities. The model that really spoke to me, I'll refer to as the Zoom model, one that broke organization of your time into planning and how much time you put into reflection, how much time you put into your current or daily activities, and how much time you put into seeing the future and building your vision. This includes planning for preparation for events that may arise unexpectedly. As a good leader and professional in public health, part of your job is to be prepared for the unexpected. People will look to you for answers and appropriate responses. So the Zoom model proposes a way to organize your time based on 20% reflection, 40% of your time spent on current daily activities or responsibilities such as work, and the remaining 40% of your time spent in knowing and understanding what the future could bring. Good leaders are always thinking forward or thinking ahead, and it's easy to get into the habit of doing that. This would look like zoom in. 20% of your time is spent on how and why things are the way they are. For example, you would think about, on a personal level, how did you get to where you are today? The people that helped you, the decisions you made, the mistakes you made, and the opportunities you have been able to experience so far. Zoom level is the 40% of your time that you spend on daily activities. This would include meetings, reports, putting out fires, and all the things you do on a daily basis. As a student, your Zoom level would be including things like taking this class, doing the assignments, taking care of work and family responsibilities, getting your car repaired, and other daily life tasks. The other 40% of your time is referred to as Zoom out. This portion of your time would consist of thinking about and planning your future and what that will look like. For example, on a micro level, if I take this class, how will it affect my job schedule, my time with friends and family, my plan for graduation, and for my career and future life choices? On a macro level, a public health organization or a community leader might look at how do we prepare for and anticipate an active shooter situation, or an outbreak of a particular disease, or contamination of the water supply, or any number of things that can occur to impact the health of the public. The ability to be a proactive planner provides you with a great opportunity to think about social entrepreneurship. What are the future needs of your community that you can be prepared to serve? By taking advantage of future planning, you can proactively create an opportunity to be the leader or go-to organization in the time of crisis. As a social entrepreneur, you can strategically place yourself or your organization in a position to be both a change agent and a community resource in times of crisis. By using a pest analysis, you can break down large pieces of your world into smaller pieces that are easier to understand, analyze, and change. For example, in the political world, what discussions are driving change in professional practice? What legislation or policy decision-making is ongoing that might affect and impact educational requirements for healthcare professionals? An example of a political driver would be the emphasis for registered nurses or RNs to attain a Bachelor of Nursing degree in order to have a better prepared workforce and to result in better health conditions. The Robert Wood Johnson Foundation reported that there is significant research indicating that a more highly educated nursing workforce can help ensure our nation's population has access to high-quality, patient-centered care. Having at least 80% of nurses holding a bachelor's degree or higher by 2020 is a key recommendation of the Institute of Medicine's landmark report. The Future of Nursing, Leading Change, Advancing Health. This report created a political shift in the world of nursing education, resulting in thousands of RNs with years of nursing experience returning to school. According to Nurse Journal, our nurses need to be prepared for the expanding professional roles as a result of an evolving and complex healthcare environment, including having the ability to practice in a variety of settings, from home care to case management. In addition, a nurse with a BSN may have a greater opportunity to be promoted into a leadership position. For example, if a nurse plans on becoming an advanced practice nurse, nurse executive, or a nurse educator, a BSN degree is usually the first step before going to graduate school. So, as a leader, you need to think about this from different perspectives, using a systems thinking approach. Questions to ask might include, who will pay for these RNs to go back to school? Does their hospital have a tuition reimbursement program? If hospital systems pay for the tuition, will costs be passed back to the consumer or insurance company? Will insurance and or healthcare costs go up? How do busy full-time professionals find the time to go back to school and meet these new requirements? How is the demand being met to teach these students? I know we've gotten pretty far out in the weeds in looking at this one area of a pest analysis, but this is how leaders have to break down their thinking in order to address change. I want to share one additional example with you that illustrates the T, or technology aspect of a pest analysis. I want you to see how a change can affect another change and create another change. Think about the field of technology. Let's look at a particular area that is quickly evolving in public health, like using telehealth to address mental health issues. How can we generate more community participation in accessing this type of healthcare? Would we offer free educational sessions? Where would those sessions be held? Would those be offered online? Through what organizations? Local public health department, hospital systems, primary care providers? How would we ensure that people who are the most vulnerable with the least access to healthcare benefits from that service? On a global level, hint, hint, next module, how would you get a service like this to a community that has no electricity or technology? As a public health leader, it is important to read about and be informed about a wide variety of issues that affect your ability to not only respond to change, but to be able to create change as well. Through the process of completing your pest analysis, you'll be able to understand how you can break down your thinking and perhaps influence the way you look at how you manage your time and your world. As you practice your reflection skills using tools like the pest analysis and the 4 shapes of reflection, it will become easier for you and will be a valuable part of your growth and understanding so that you develop the ability or improve your current ability to see the world through different lenses.